The fluorescent lights of the Sterling Medical Center's ICU hummed a monotonous, sterile tune at 3:17 a.m. It was a sound Clara Vance knew better than her own heartbeat. For 6 years, the graveyard shift had been her sanctuary, a quiet place of beeps, whispers, and the gentle hiss of ventilators. At 47, with streaks of premature silver woven through her brown hair and a quietness that bordered on invisibility, she was part of the hospital's nocturnal furniture. She moved with a practiced slowness, a slight, almost imperceptible limp favoring her right leg, a detail most people missed or simply attributed to age. Tonight, she was restocking Crash Cart 3. It was a ritual she performed with a devotion that others mistook for obsessive-compulsive disorder. Each ampule of epinephrine was aligned perfectly, each intubation blade checked for light, each defibrillator pad pack facing the same direction. To her, it wasn't obsession, it was readiness. In a place where seconds were the currency of life, you didn't have time to search. You had to know. The squeak of expensive Italian leather shoes on polished linoleum announced his arrival before his voice did. Dr. Julian Sterling, chief of surgery and son of the hospital's founder, swept into the ICU like a minor king inspecting his domain. He was flanked by his usual acolytes, Dr. Greg Peterson, a third-year resident with an ego that already outstripped his skill, and Jessica, a young, ambitious nurse who mirrored Sterling's every sneer. "Still at it, Nurse Vance?" Sterling's voice was smooth, cultured, and laced with a casual cruelty that was his signature. He stopped before the cart, his eyes scanning for a flaw. One would think that after, 20 years in the field, this could be done with a bit more efficiency. Clara didn't look up. Her hands, which had been steady a moment before, developed a faint tremor. She hated that tremor. It was a ghost, a phantom of a past she kept buried under layers of silence and routine. "Just making sure everything's in order, Doctor." Her voice was a murmur, barely audible over the hum of the machines. Sterling's lip curled. He pointed a manicured finger at a row of saline bags. "And is this your idea of in order? The labels aren't perfectly aligned. Do you understand what this hospital represents, Clara? It's not some backwater clinic. We have a reputation for perfection. A reputation you seem determined to tarnish with your plotting." Greg snickered. Jessica watched Clara with cold amusement. "She's trying her best, Dr. Sterling," Jessica said, the false sympathy in her tone more insulting than open mockery. "Her best is a liability," Sterling shot back, his voice rising just enough for the other staff at the nurses' station to hear. He leaned closer, his cologne cloying and expensive. "Look at me when I'm speaking to you, nurse." Clara slowly raised her head. Her gray eyes were placid, deep pools that revealed nothing. She saw his bespoke suit, his Patek Philippe watch, the contempt in his gaze. She had seen eyes like his before, in men who believed their status made them gods. It never did. "Yes, doctor." "Fix it," he commanded, "and try to keep up. We're saving lives here, not sorting laundry." He turned on his heel and continued his rounds, his entourage trailing in his wake. Clara's gaze dropped back to the cart. Her hands trembled more noticeably now. She took a slow, controlled breath, a technique she had learned long ago to push down the noise, the memories. In through the nose, hold for 4, out through the mouth. The tremor subsided. She meticulously realigned the saline bags, her movements becoming precise once more. The young nursing aide, Maria, who was refilling water pitchers nearby, gave her a look of quiet sympathy. Clara offered a small, tired smile in return. Maria was kind, but in Sterling's kingdom, kindness was a weakness you couldn't afford to show. An hour later, the second humiliation came. A patient post-op from a complex cardiac procedure began showing subtle PVCs on his EKG. Clara, who was charting at the central station, noticed the pattern change. It was faint, a slight widening of the QRS complex that preceded a more dangerous arrhythmia. She approached Dr. Peterson, who was overseeing the patient. "Doctor," she said softly, pointing to the monitor, "Mr. Henderson's rhythm is changing. We might want to consider a bolus of lidocaine before it degrades into VTACH." Greg glanced at the screen, then at her, his expression one of profound irritation. "I see a few premature beats, nurse. It's expected. Don't overreact." "It's not just the frequency, it's the morphology." Clara insisted, her voice still a whisper. "I've seen this pattern before. It's a precursor." Just then, Sterling returned from his coffee break. "Is there a problem here, Dr. Peterson?" Greg seized the opportunity. "No problem, sir. Nurse Vance was just offering her expert opinion on cardiology. Apparently, her nursing degree from some community college trumps 4 years of medical school and 3 years of residency." Sterling let out a short, derisive laugh. He looked at Clara, his eyes full of scorn. "Vance, what did I tell you about keeping up? I can now add not overstepping to that list. Your job is to monitor, report, and administer, not to diagnose. Leave the thinking to those of us with the credentials to do so. Are we clear?" "Crystal, doctor," she murmured, stepping back, melting into the shadows of the ICU once more. 10 minutes later, Mr. Henderson's monitor blared with the screeching alarm of ventricular tachycardia. Greg's face went white. Sterling cursed and shoved him aside, barking orders for the very drug Clara had suggested. They stabilized the patient, but the danger had been real. Sterling, ever the hero of his own narrative, took the credit. "Good catch on my part," he announced to the room. "You have to be vigilant. Can't trust the monitors alone." He shot a glare at Clara, as if the entire incident had been her fault. She said nothing. She just watched, her expression unreadable, her mind a fortress. She didn't know that miles away, a different kind of crisis was unfolding. On a darkened stretch of highway outside the city, a black SUV had been forced off the road, riddled with bullets. The lone passenger in the back, a man in his late 60s, was bleeding from a dozen shrapnel wounds, his security detail dead. He was General Marcus Thorne, chairman of the Joint Chiefs of Staff, though the manifest of the private ambulance now speeding toward Sterling Medical Center listed him as John Doe, car accident victim. The men who had ambushed him were professionals, and they were not finished. The ambulance arrived with no sirens, pulling into the private rear entrance reserved for VIPs. A frantic hospital administrator met them, waving them toward a secured elevator. "Chief of Surgery is waiting in ICU. Severe trauma, multiple GSWs. Injuries from the accident," the man stammered, correcting himself. General Thorne was wheeled into the ICU, unconscious, his body a canvas of hastily applied field dressings. Sterling, relishing the high-profile emergency, took charge with theatrical bravado. "All right, people, let's earn our paychecks. Get me a full workup, trauma panel, cross-match 10 units of O-neg. Let's move, move, move." Clara watched from the periphery. She saw the dressings. She saw the pattern of the wounds on his exposed arm. Her mind, a finely honed diagnostic tool forged in the crucible of war, instantly processed the data. Symmetrical blast pattern, puncture wounds consistent with high-velocity fragmentation. No glass shards. This isn't a car accident. Her eyes flickered to the general's face, pale under the harsh lights. There was something familiar about him. A face from a briefing, a lifetime ago. As Sterling and his team swarmed the patient, barking orders and attaching lines, Clara's attention shifted. Her head tilted, her gaze lifting toward the main entrance of the ICU. It wasn't a sound that had alerted her. It was a lack of one. The usual distant chatter from the hospital's main corridor had gone silent. The air had grown heavy, still. Her hypervigilance, so often mistaken for anxiety, screamed at her. Something was wrong. Check exits. Primary, the main doors. Secondary, the service stairwell. Tertiary, staff elevator. Her eyes methodically scanned the layout. Potential cover, central nurses' station, supply closets. Potential threats, 3 visitors in the waiting area, now silent. The main ICU doors hissed open. 2 men walked in. They were not doctors. They wore janitorial uniforms, but they didn't belong. Their posture was wrong, too rigid. Their hands were empty, but they moved with the coiled tension of predators. Their eyes weren't looking at the patients. They were scanning the staff, assessing, identifying. One of them subtly touched his ear, a gesture she knew all too well. Comms. Then, 2 more appeared at the service stairwell entrance, effectively cutting off the floor. They carried bulky duffel bags. The first 2 men reached into their janitorial carts and pulled out suppressed firearms. The illusion of peace shattered. "Nobody move," the lead intruder commanded, his voice a low, disciplined bark. "Hands where I can see them, now!" Panic erupted. A nurse screamed. Greg Peterson dropped a tray of instruments, which clattered loudly in the sudden silence. Dr. Sterling froze, his face a mask of disbelief and terror. Who are you? What do you want?" "Silence!" the lead intruder snapped. He was calm, professional. This wasn't a robbery. It was an operation. "We are looking for a patient. Cooperate, and you will live." His partner began moving down the line of beds, checking wristbands. Sterling, his arrogance evaporating into pure fear, began to babble. "Take whatever you want. Drugs, money. I'm the chief of surgery here. I can get you anything. Just don't hurt anyone." Clara hadn't moved. Her body was still, but her mind was a whirlwind of tactical calculations. 4 hostiles, suppressed MP7s by the look of them, body armor under the uniforms, disciplined, pros, objective, the general. My objective, protect the patients, protect the staff. The intruder checking wristbands reached the general's bed. He looked at the John Doe band, then at the man's face. He pulled a photo from his pocket, compared it, and nodded to his leader. "We have the target." "Excellent," the leader said. "Prep him for transport. We're leaving." He gestured with his weapon at the staff huddled together. "The rest of you on the floor. Face down." Maria, the young aide, let out a terrified sob and stumbled. One of the intruders, impatient, shoved her hard. She fell, her head cracking against the leg of a gurney with a sickening thud. She lay still, a dark pool of blood beginning to spread from a gash on her temple. That was the moment the world shifted on its axis. For Clara Vance, the quiet nurse, the timid, aging woman who apologized for existing, disappeared. In her place, something else rose to the surface, something cold, precise, and infinitely more dangerous. Her trembling hands became rock steady. Her posture, usually a soft curve of deference, straightened into a rigid line of military bearing. The whisper was gone. "Get away from her," she said. The voice was unrecognizable. It wasn't loud, but it cut through the terrified silence with the sharp authority of a commanding officer on a battlefield. It was clipped, resonant, and held zero trace of fear. The intruder who had shoved Maria turned, a look of mild surprise on his face. "What did you say, Grandma?" Clara's eyes, no longer placid pools, were now chips of glacial ice. She took one step forward, her limp gone, replaced by a balanced, predatory stance. She assessed him in a fraction of a second. 5'11", 200 pounds, right-handed, weapon held at low ready, complacent. "I said," she repeated, her voice dropping even lower, "get away from her." The man chuckled and started to raise his weapon. It was the last mistake he would ever make. Clara moved with a speed that defied her age and appearance. In 2 steps, she closed the distance. Her left hand shot out, not for the gun, but for the man's wrist, twisting it inward with brutal, practiced force, breaking his grip. Her right hand, holding a heavy-duty stainless steel clipboard she'd been charting on, swung in a tight, vicious arc, striking him just below the ear at the mandibular nerve. His eyes rolled back in his head. As he staggered, she didn't stop. She drove her knee into his sternum, collapsing him backward. Before his partner could even react, Clara had snatched a scalpel from a surgical tray on the counter beside her. She pivoted, the downed man's body acting as a momentary shield. The second intruder raised his MP7. He was too slow. Clara lunged forward, low and fast. The scalpel, held in a reverse grip, flashed once, a silver streak in the fluorescent light. It sliced through the man's brachial artery in his armpit, a place unprotected by his body armor. He screamed, dropping his weapon as blood sprayed across the sterile floor. 2 down in less than 3 seconds. The ICU was frozen in a state of collective shock. Dr. Sterling stared, his mouth agape, his mind unable to process the meek nurse transforming into a whirlwind of lethal violence. The 2 remaining intruders at the doors opened fire, but they weren't shooting at Clara. They were shooting at the ceiling, trying to regain control. "Down! Everyone down!" Clara was already moving. She kicked the dropped MP7 under the central nurses' station and vaulted over the counter with an agility that was utterly astounding. Bullets stitched the wall where she had been a second before. "Greg! Jessica!" she barked. Her voice was pure command. They flinched as if struck. "Get Maria behind this counter. Now! Apply direct pressure to that head wound." Stunned into obedience, they scrambled to drag the unconscious aide to safety. From behind the station, Clara's mind raced. 2 hostiles left guarding the exits. They know my position. They'll try to flank. The general is exposed. Need to create a new problem for them. Her eyes landed on the crash cart she had so meticulously stocked. An idea, insane and brilliant, formed. She grabbed the defibrillator. It wasn't plugged in. It didn't matter. She wasn't going to use it to shock anyone. She ripped the heavy metal paddles from their holsters. The lead intruder was cautiously advancing, using the beds as cover. "Come out, lady. You don't want this to get any worse." Clara's voice came from the shadows of the nurse's station. "He needs a doctor. The general. He's crashing." It was a lie, but a good one. It forced their hand. The leader glanced at his target. The general's monitor, which Clara had a clear view of, was stable. But the intruders couldn't know that. "Alex, cover me!" the leader yelled to his last man and made a move toward the general's bed. That was the opening. Clara exploded from behind the counter, not toward the leader, but toward the wall. She slammed her hand onto a large red button labeled "Emergency Oxygen Shut Off." It was a desperate move. With a loud hiss, the life-giving gas that fed every ventilator in the ICU was cut off. Alarms began to blare from every bed, a cacophony of urgent, shrieking alerts. The controlled environment descended into chaos. The flashing lights and screaming alarms were a perfect distraction. In that moment of sensory overload, Clara moved. She hurled one of the heavy defibrillator paddles like a discus. It spun through the air and smashed into the face of the hostile named Alex, who was guarding the main door. He staggered back, stunned, his nose clearly broken. Clara was on him in a heartbeat. She didn't use a weapon. Her hands were the weapons. A precise strike to the throat. A palm heel strike to the chin. He crumpled to the floor, unconscious. Now it was just one. The leader. He stood frozen between the general's bed and the chaos, his weapon swinging back and forth between the threat he could see, Clara, and the asset he was supposed to protect. He made his choice. He turned his weapon on the general. "One more step and he dies!" Clara froze. Her eyes met his. There was a flicker of recognition in his gaze, a dawning horror. He'd seen operators move like her before, but not here. Not like this. "Who are you?" he breathed. Clara's gaze was unwavering. She was assessing the general. His breathing was shallow. The blast trauma she'd suspected. Internal injuries were a certainty. He was stable for now, but not for long. "I need to treat my patient," she said, her voice dangerously calm. She took a deliberate step forward. "I'll shoot him. I swear to God," the man screamed, his discipline finally breaking. Clara's eyes flickered to the monitor above the general's head, then to the fourth stand next to him, then back to the man. A plan, precise and clinical, locked into place. "You're right," she said. "You should have shot him already." The man hesitated, confused by her words. In that split second of hesitation, Clara's hand darted to the crash cart she was now standing beside. She grabbed a 10 cubic centimeter syringe of epinephrine. With a flick of her wrist, she removed the needle cap. "But you're not a soldier," she said, taking another step. "You're a coward who attacks hospitals." She didn't throw the syringe. She held it. Her other hand grabbed a full bag of saline from the IV pole. The man's nerve broke. He fired. But Clara was already in motion. The instant his finger tensed, she swung the heavy saline bag in a wide arc. The bag, weighing over 2 pounds, intercepted his arm as the gun went off. The shot went wide, shattering a window across the room. The force of the impact knocked the weapon from his grasp. He lunged for it. Clara was faster. She sidestepped his clumsy charge and drove the epinephrine-filled syringe deep into his thigh, plunging the full dose of adrenaline directly into his femoral artery. He screamed as the massive undiluted dose hit his system. His heart rate would skyrocket to catastrophic levels. He clutched his chest, his eyes wide with terror, as his own body turned against him. He convulsed and collapsed, neutralized without a single bullet from her. Silence descended, broken only by the wail of the unit's alarms and the ragged breathing of the terrified staff. Clara Vance stood in the center of the carnage, surrounded by 4 disabled hostiles. She was breathing heavily, her nurse's uniform splattered with blood. She looked at the chaos, the fear on the faces of her colleagues. Then, the mask of the quiet nurse began to return. She walked over and slammed her hand on the oxygen override, and the hissing of the ventilators returned to normal. The alarms began to quiet down, one by one. She knelt beside Maria, her touch gentle. "Greg, get me a suture kit and a head CT order, stat. Jessica, I need a full neuro assessment. Check her pupils." They stared at her, paralyzed. "Now!" she roared, the commander's voice returning for a split second. They jumped into action, their fear of her now greater than their shock. Clara turned her attention to the general. Her hands moved with an efficiency that made Sterling's theatrical urgency look like a child's game. She cut away the field dressings. "Collapsed lung, tension pneumothorax. I need a 14-gauge needle and a chest tube tray." Sterling, pale and trembling, finally found his voice. You can't, you're a nurse." Clara didn't even look at him. She snatched the large-bore needle from the cart herself. "He has about 90 seconds before he goes into cardiac arrest. Are you going to help me save him, doctor, or are you going to stand there and quote my job description?" She located the second intercostal space, mid-clavicular line, with practiced ease. "This is a needle decompression. Watch closely. You might learn something." With a firm, steady hand, she plunged the needle into the general's chest. There was a soft hiss of escaping air. The man's stats on the monitor immediately began to improve. It was at that moment that the roof of the hospital began to vibrate with the percussive thump, thump, thump of heavy rotor blades, a sound that didn't belong in a city center, a sound Clara knew like the back of her hand, a Black Hawk. Moments later, the doors to the service stairwell burst open. A team of 6 men, clad in black tactical gear, swarmed the ICU. They were silent, professional, their movements a symphony of deadly grace. They saw the neutralized hostiles, the blood, the terrified staff, and the lone woman standing over a patient with a chest tube tray. Their leader, a major with a face carved from granite, saw her. His eyes widened slightly. He stopped, raising a hand to halt his team. He stared at her for a long moment, taking in her blood-stained uniform and the look of fierce concentration on her face. "Angel 6?" he said, his voice a low rumble of disbelief. Clara looked up from her work. A flicker of recognition passed through her eyes. "Took you long enough, Razor." The major broke into a grin of pure relief and awe. He strode forward, his boots silent on the floor. He stopped a few feet from her and executed a perfect formal salute. "Ma'am, Lieutenant Commander Vance, we came as fast as we could." The entire ICU staff stared, their minds reeling. Lieutenant Commander? Dr. Sterling looked as if he'd been struck by lightning. "Commander, that's not possible. She's a nurse." The major, Razor, turned his head slowly, his gaze falling upon Sterling. The grin was gone, replaced by a look of utter contempt. "This nurse," he said, his voice dangerously low, "is Lieutenant Commander Clara Vance, retired United States Navy. She wasn't just a nurse, she was a Special Operations Combat Medic attached to SEAL Team 6. Her call sign is Angel 6 because she has personally saved the lives of more than 50 operators under fire." He took a step closer to Sterling, who shrank back. "She holds the Navy Cross for pulling 3 men out of a burning helicopter under enemy fire in Afghanistan. She has 3 silver stars, a bronze star with valor, and 4 purple hearts. The limp you probably mock her for is from RPG shrapnel that is still lodged less than a centimeter from her spinal cord, a piece of shrapnel she got while shielding a wounded Marine with her own body." Each word was a hammer blow to Sterling's world. Jessica and Greg looked at Clara with a mixture of terror and profound shame. Just then, a weak groan came from the hospital bed. General Thorne's eyes fluttered open. He saw the black-clad soldiers, then his gaze fell upon the woman checking his IV line. His eyes widened. "Clara," he rasped, his voice weak. "My God! Is that you? Angel 6? Clara gave him a small, gentle smile, the same tired smile she'd given Maria earlier, but this time, it reached her eyes. "Rest easy, General. You're safe now." Thorne looked from her to the dumbfounded Dr. Sterling. He understood immediately. "This woman," the General said, his voice gaining strength, "is one of the finest medics and warriors this country has ever produced. Whatever she says, you do it. Is that clear, Doctor?" Sterling could only nod, his face ashen. Razor turned back to him, his voice dripping with ice. "We have recordings from the hostiles' comms. They document your cowardice, Doctor. Offering up your patients, hiding while this woman, this hero you called a liability, fought for every life on this floor. I believe the hospital board, not to mention the Department of Defense, will be very interested in hearing those recordings. The color drained completely from Sterling's face. He knew he was finished. His career, his reputation, his kingdom, all of it had just been dismantled by the quiet, middle-aged nurse he had delighted in tormenting. Later, after the general had been airlifted to Walter Reed and the federal agents had cleaned up the scene, the ICU was quiet again. The sun was beginning to rise, painting the sky in shades of orange and pink. Clara was finishing her shift. She had changed into a clean set of scrubs and was completing her chart on Maria, who was now resting peacefully in a room, recovering from a concussion. The floor was different now. The whispers that followed her were not of mockery, but of awe. Staff members avoided her eyes, not out of contempt, but out of a deep, humbling respect. Jessica and Greg had both approached her separately, stammering apologies she had accepted with a simple, non-judgmental nod. As she was about to leave, Razor found her by the nurse's station. The chaos was gone, but the ghost of it remained. "The general is stable," he said. "He wanted me to give you this." He held out a small velvet box. Clara opened it. Inside was a simple challenge coin, one reserved for the highest echelons of command. On it was the inscription, "To Angel 6, you are never off duty." He also said, "There's a place for you at Walter Reed, a teaching position, head of the combat trauma department. Name your price." Clara looked at the coin, then out at the ICU floor. She saw the steady rhythm of the monitors, the quiet dedication of the night staff. She thought of Maria. She thought of the years of peace she had tried to build here, a quiet penance for a life of violence. She had thought she was hiding, but she wasn't hiding. She was standing watch. "I appreciate the offer, Major," she said, her voice the soft, familiar murmur he had not heard before. "But I think I'm needed here." She closed the box and handed it back to him. "Just tell him, Clara is on duty." Razor looked at her, at the quiet strength that radiated from her, a strength that had nothing to do with weapons or metals. It was the strength of a healer. He nodded, understanding. "Yes, ma'am." Clara Vance picked up her worn handbag, gave a final reassuring look at the sleeping ward, and walked out into the morning light, her limp just a little less pronounced. The quiet nurse was gone, but so was the commander. In their place was simply Clara, a woman who had finally integrated the two halves of her soul, ready for whatever came next, one quiet shift at a time.